Although our ears may be relatively smaller than many other parts of the body, they are full of incredibly sensitive nerve fibers. As a direct result of this, your ears are just as prone to itching as their size allows. Your ears might develop a sense of chronic itching simply because they are so sensitive to touch. However, it is important to remember that itchy ears can also be a clear sign of an underlying medical condition. By understanding more about the underlying causes of itchy ears, you can discover methods to relieve it. Hello, I'm Mohammed Zari, an instructor in internal medicine and surgery. A very warm welcome to the Dr. Koob YouTube channel. There can be various different reasons for itchy ears. The first cause is dry skin. If your ears don't produce enough wax, the skin inside your ear canal becomes dry and irritated, causing it to itch. Earwax has natural lubricating effects. Its absence can often be the main reason for itchy ear skin. You might even notice some flaking and peeling skin coming from your ear canal. The second cause is ear canal dermatitis. This medical condition typically occurs when the skin located both inside and directly around your ear canal becomes inflamed. This uncomfortable situation can often be the result of an allergic reaction to various products used in or near your ear. For example, common personal care products, certain medications, or even the types of metal found in earrings can frequently cause these skin issues. Another type of dermatitis in the ear is eczematous otitis, which has an unknown cause. The third cause is otitis externa, or outer ear infection. Otitis externa, or infection of the external ear canal, can cause ear pain as well as itching. This type of ear itching after an infection is also commonly known as swimmer's ear. It is called this because it often happens after swimming and is caused by inflammation, usually the result of an infection. This condition can also lead to redness and swelling of the ear canal. The fourth cause is the regular use of hearing aids. Hearing aids can cause water to get trapped in the ear or trigger an allergic reaction to the device itself. Ill-fitting hearing aids can also put pressure on certain areas of the ear and lead to itching. The fifth cause is psoriasis. Psoriasis is a chronic skin disease that is accompanied by the appearance of distinctive red rashes. Psoriasis can develop in highly visible areas of the body, such as the forearms or within the ear canals. The sixth cause is food allergies. Sometimes having an allergic reaction to a certain food can cause itching inside your ears. Some of the most common food allergies that people face today include tree nuts, cow's milk, fresh fish, shellfish, whole wheat, and soy products. The seventh cause is allergic rhinitis. Allergic rhinitis, often called hay fever, occurs when the body reacts to harmless airborne particles. These environmental triggers typically include things like seasonal pollen, dust mites, and fur from common pets. This medical condition can cause itching in the ears, eyes, and throat, and it may be accompanied by symptoms such as watery eyes, a runny nose, headaches, and sneezing. What causes itchy ears? Dealing with itchy ears can be incredibly irritating and quite bothersome. It might even seem like scratching helps at first, but in fact your ears will probably feel much worse when you attempt to scratch them for relief. During a serious infection, itchy ears can often be accompanied by a fever, noticeable swelling, and even fluid discharge coming out of the ear. So when exactly should you consider seeing a medical professional about this issue? If you have intense or uncontrollable bleeding, or heavy fluid discharge coming from your ear, if you unexpectedly begin to experience significant hearing loss, or if your itchy ear symptoms do not improve over time or with home care, you should see a professional ear, nose, and throat specialist immediately for a full evaluation. So how is an itchy ear treated? Ear sensitivity and itching usually happen due to underlying issues with the skin inside the ear. Treatment usually focuses on effectively addressing these specific conditions. Common causes include earwax, excess water in the ear, and foreign particles or debris in the ear. If you are suffering from itchy skin and irritation, and you visit an ENT specialist, your doctor may prescribe one of the following treatments I'm about to mention. Antibiotic ointment If dry skin is causing the itch, using baby oil to soften the skin, topical steroid ointments that relieve inflammation, such as 1% hydrocortisone cream or 0.1% beta-methazone cream, swimmer's eardrops or a diluted solution of alcohol, acetic acid or hydrogen peroxide. And if your ear itching is accompanied by a high temperature or discharge of blood or pus from the ear, your doctor may prescribe antibiotics for the ear itch and the resulting infection. If you intend to treat persistent ear itching at home using traditional medicine methods, you can use various effective options like apple cider vinegar, fresh garlic, warm oil, ginger, and other natural remedies that I will mention next. For example, to treat ear itching with garlic, you can use its potent oil to help relieve ear pain and underlying infection as well. One of the most well-known and trusted home remedies for relieving ear itching is high-quality olive oil. Olive oil helps effectively remove excess earwax and keeps your delicate ear canal sufficiently lubricated and protected throughout the day. It can effectively soften hardened earwax, making it much easier to remove from the ear. It also has antiseptic properties that may help reduce the risk of an ear infection. Lie down on your side with the affected ear facing upward. Gently pull the outer part of your ear in an upward and backward direction. Using a dropper, carefully put 2 to 3 drops of soothing warm olive oil directly into the opening of your ear canal. Gently massage the skin in front of your ear in a circular motion to help the oil penetrate deep into the canal. After that, stay on your side for 5 to 10 minutes. Gently wipe away any excess oil that drains from your ear when you sit back up, and then repeat the same process on the other ear if needed. Hydrogen peroxide is very effective in dealing with itchy ears caused by wax buildup. As a matter of fact, many commercial eardrops contain hydrogen peroxide or a similar compound as one of their main ingredients. However, the excessive use of hydrogen peroxide in the ear canal may exacerbate the dryness of the skin within your ear canal. Hydrogen peroxide works to break down and thin out the consistency of earwax, which triggers a bubbling reaction that helps it exit the ear. Mix equal amounts of 3% hydrogen peroxide and water. Carefully fill a dropper with this solution. Gently tilt your head to the side and put several drops of this solution into your ear. Maintain this position for a short period of time, then slowly tilt your head over to the opposite side, so the solution can drain out. Wipe away any remaining earwax with a soft, clean cloth and repeat this entire process for the other ear. The next method is using white vinegar. White vinegar is most effective when thoroughly mixed with rubbing alcohol. While white vinegar effectively helps to dissolve earwax, rubbing alcohol acts as a powerful drying agent and helps to evaporate any excess liquid left in the ear. To begin, carefully mix equal amounts of distilled white vinegar and rubbing alcohol together in a small bowl. Once mixed, soak a soft cotton ball in the prepared solution for use. Gently tilt the affected ear upward and pull the outer ear up and back. Then administer 2 to 3 drops of this solution into your ear canal. Wait for about 5 minutes, then slowly tilt your head downward in the opposite direction of the treated ear. This allows gravity to do its job so the solution and softened wax can drain out of your ear canal. Gently remove the excess earwax from your outer ear using a clean tissue. To avoid any potential irritation, please do not use any of the following items I mentioned to clean your ears. Avoid using cotton swabs, cotton buds, paper clips, and bobby pins. All of these can make your ear irritation worse. Make sure to remember to use hypoallergenic jewelry for your piercings. Using these specific items can effectively help you prevent allergic reactions that often lead to persistent itching. If you happen to swim regularly, it is highly recommended to use a specialized solution to dry out any excess water trapped in your ear canal. Additionally, you can also use protective earplugs while swimming and use a hairdryer on a low heat setting from a safe distance to ensure dryness. If you frequently experience excessive earwax production, you might want to keep it under control using professional doctor-approved methods such as eardrops. Thank you so much for staying with me until the very end of this informative video. If you have any questions, leave a comment and I'll reply. Bye.